You are in pain. You're in the hospital. And the surgeon says, we are going to wait. That can sound terrifying. But in surgery, waiting can be deliberate, highly skilled decision and not hesitation. What I'm explaining today is how doctors think, not advice for any individual situation. I am a practicing surgeon. In this video, I will explain why doctors sometimes choose observation instead of immediate surgery. Not because we are unsure, but because in some situations, waiting actually leads to a better and safer outcome. Surgery can be life-saving, but it's never neutral. Every operation is a controlled medical intervention. Even when everything goes well, surgery involves risk, bleeding, infection, effects of anesthesia, recovery time. So the real question is never just, can we operate? It's, does surgery offer a better outcome than non-operative treatment or careful observation? When surgery is clearly indicated, earlier treatment is usually better. But not every condition needs an operation right away, or at all. In some situations, a non-operative treatment or observation can lead to improvement, without exposing the patient to unnecessary surgical risk. The challenge is deciding who benefits from early surgery and who benefits from careful monitoring first. In the emergency setting, when surgery is truly indicated, it should be done as soon as possible. Delaying definitive treatment rarely makes things better. Without source control, most surgical problems progress. One of the hardest parts of surgery isn't the operation. It's deciding whether an operation is actually indicated. Early on, symptoms can be unclear and overlap between very different conditions. Sometimes observation isn't about delay. It's about determining whether surgery is needed at all. Once surgery is done, it cannot be undone. Tissue is removed, anatomy is altered, the course of treatment changes permanently. Among surgeons, there's a simple mantra. You usually get one chance to achieve a really good end result. That's why the decision to operate and the timing of that decision matters so much. From a patient's perspective, waiting can be very difficult. Pain, uncertainty, no clear timeline. Even when the medical plan is sound, those factors can create anxiety, and that's why communication matters. Explaining what we're watching for, how often reassessment happens, and what would trigger action. That's what makes observation feel like care, not inaction. When a surgeon says we're going to wait, it doesn't mean nothing is happening. It usually means active observation, repeated examinations, monitoring vital signs, following lab results, reassessing when needed. There is a plan and a low tolerance for deterioration. Waiting is only an option when it is safe. If a patient shows signs of rapid deterioration or a clearly evolving surgical problem, observation is no longer appropriate. At that point, the priority becomes definitive treatment. Surgery is about judgment as much as technical skill. Sometimes that judgment means acting immediately. Sometimes it means watching closely and reassessing. Both decisions carry responsibility, and both are made with the same goal: the best possible outcome for the patient. If you're interested in how surgeons think and make decisions, I share educational videos like this regularly. You are welcome to subscribe if it's useful to you.